Hi, I'm Dr. Rajani. Thanks for joining me today. Today I'm going to share with you my treatment. I did a video on the skincare. I'm not sure if it posted yet at the time of this filming. You'll probably either have it right around the time or slightly after, so you can watch about skincare. People have asked, hey, share what you've done. Essentially, I try everything we have in the clinic, of course, but recently had threads, a little bit of filler, a little bit of jawline. So let's go through the treatment. Some of you are interested, some not, but you've asked. We talked about jawline. We showed celebrities in terms of the jawline angles. So we'll put this together with that and you can watch what I've done and the product choice. There's so many ways and so many different things that you can do. We're also going to focus a little bit on the series of how to create beauty. Regarding the eye, we've done the jawline a little bit. We'll talk about the eye and eye dimensions. Today is jawline filler, chin filler, and PDO thread. So let's dive into it. 3 seconds. So here, important to cleanse, and I use different things. You can use a combination of alcohol and peroxide. Puricin is really common now. But spraying the whole area down with disinfectant and spray that sometimes you don't see that's on the hair, on the bed, we just spray the whole area with products that are safe, and then having the patient be very stable with the head and comfortable. Any muscle movement is going to make this more painful. And you never touch the steel of the thread. So here, Nurse Jamie's placing the PDO threads in the submental area at this point. And the main idea is neck, or when we look down, we all lose collagen. Sometimes there's a fat layer there. Right where that thread is, there's also submandibular glands. So right in that region, a lot of times, even if you remove the fat, even if you tighten the skin, there might be submandibular glands that are creating a non-contoured look. And you can use Botox to shrink them. Again, this is all advanced stuff, but I've done this over many years, and there is data and papers on it as well. And here you can see when the threads are going in, she's placing them at the exact depth. Not too deep, obviously too superficial. A lot of these threads are blue in color. You see the white portion there by the hub of the thread. That's the sponge. Very important that the thread engages when it goes in. I just opened a package of threads recently and they crumbled in my hand, and they were open and they oxidize, or they lose their stability definitely with oxygen over a matter of days to weeks. So having fresh product is really important and not saving it. Imagine you get your product from different places. You don't know that the product's fresh. A lot of people are buying this stuff online. The threads I'm using here, made in the USA, and you can go see the factory. But if you get your threads in other areas and they don't work, you just don't know. You don't know the quality of thread. You don't know how long they last. To be honest, they might say PCL, PDO, PLLA, and be nothing of the sort. Do I see it? Yes. People contact me for problems all the time on Instagram Messenger. That's how I see it. Here in the submental area, I'm getting the threads placed so that we can tighten the skin. She's using a pattern to kind of brace the area. There's many different patterns you can do, and you can see we're talking back and forth. I didn't use any anesthetic. I mean, I honestly think it's ridiculous for a little tiny poke, and men are the worst. The men pass out. So if you're going to use anesthetic, use it for the men maybe. Women, this is a breeze, and I've used nothing here. There's some openings you see alongside there. That's from jaw filler that I had prior, and I'll show you those openings. But you can see right superior to where she placed that thread, there's a cannula opening where she's touching now. That's what you're seeing there. And then she's placing the thread. Now I'll get a little bit of swelling, and you might see a little bit of swelling today. I also did a little PR up under the eyes that you might be able to see if you look up there. And so you get a little bit of swelling underneath. So that was her final pattern. And she's placing them and then moving them out. A little light spin, especially if you're using twist, sometimes helps them engage. But you're trying to keep the submental skin full with collagen. We make collagen every day and we break it down. That machinery over time becomes imbalance is the best way to think of it. Now, if you're exposed to sun, if you're exposed to different elements, it's going to speed up. Remember your aging rate? I did a whole video on aging rate. We covered sleep. I'm going to cover 5 other factors. I'm going to keep this collagen for years as long as I mind my sleep, my exercise, my diet, and take care of my skin, avoid sun, and cover up. And the older we get, the more we're willing to have our white skin with the zinc. So if you have a great sunscreen, that helps, and covering up. Same with sports like skiing, and when you're exposed to the sun at high elevations, it's very damaging. Cigarette smoking. Everyone's going to want to know, how long does it last? What do? I want this personally repeated at around 6 weeks, and that's how I package it, because I want collagen stimulation, maybe 25, 30 threads here in total. That's not a great dose. And I'm going to show you a slide in a minute to show you what this looks like when there's a cross section of skin. So she's removing the threads here, slight twist to them. And you can see the areas, if you put a little pressure, we get a little bleeding. It just helps prevent a bruise. I got a couple little bruises, not a big deal. These do not typically cause occlusion or problems that can be associated with fillers. But everything has side effects, and you can get infection, thread visibility, and you can just look unusual. I see people doing these threads themselves in weird patterns, different depths, and it could look unusual if you're not careful. Now, here I'm showing you, I talked about the openings for the filler. I'm using, well, actually my nurse Jamie is using radius along the jawline. Watch my video on the gonial angle, the jawline. We looked at celebrities. We talked about the bizygomatic width and to the bigonial width. You see me on YouTube every day, so you'll be able to see what things look like. But she's using radius. You can see the white of the filler there, a high G prime filler to create that jawline. Now here I'm going to get chin filler. We're using Restylane Lift here. We like that in the chin, lifting up the mentalis, injecting at a very specific plane to avoid the vessels as best as possible. This is a real problem if you get necrosis, because you can get death of tissue within the mouth through the palatine artery. Very bad. And as it is, this hurts. When you put a CC and you need enough volume here, this is a bit painful and it can fool you for occlusion. But along with the jawline, chin projection needs to be addressed. That's what we're doing. Just 1 vial, 1 ml, a drop in the bucket for a chin, but it's that quick. Now, if we look here, we can see a cross section of skin that's been removed. That arrow is pointing to 2 threads. You see the area in the center where there is a lucency, it's just white. That's the thread. Look at the close-up. Around the thread, you have lymphocytes, histiocytes, eosinophils, fibrosis. We're producing type 1 collagen. There's type 1, 2, and 3. 2 is more around bone, teeth, cartilage. 1 and 3 is in skin, mainly type 1. Type 3 is scar tissue. So it's mainly type 1 collagen that will replace that whole area. So when we put the threads in the jawline, that's what I was trying to achieve. Here you can see a picture of me getting the platelet-rich fiber, and of course I had 1 dose that I did a video on. You can go back and watch Plasmaeyes. This is the second treatment of that, and I'm going to do 2. I'll do a little IPL and then a filler maybe in 3, 4, 5 months. For me, I'm not too concerned. I just want to maintain. I'm in no rush to get it done. If people see my eyes are a bit hollow, I don't care. But I do want to do a little IPL or target some browns before I do the filler. Last time the filler lasted me 5 years, so why not take the time and do it properly? But that's what goes into an eye and an under eye when you're not young, or you have genetic dark circles and so on. It's not that simple. So you wanted to know some of the treatments I did. There's PRF, There's Jawline, there's Threads, and there's chin filler, and just 1 ml because I've had 1 ml prior. And I've had some radius along the jawline prior too. So what would that roughly cost? Just about everything you get done, or that's someone comes in, a combination like that in my clinic, are going to get 2 sessions typically, and it's upwards of $3,000. $3,000 to $5,000 is a very normal ticket price for something, I believe, done well. Done with the amounts that are needed, done professionally with follow-up, and with someone looking at your face over 10 to 20, 30 years. That's what you want, someone for the long haul. So you're always looking angles, know what's been done before, what filler worked, what didn't work, the neuromodulator or botox type of product pattern. So what's drooping, what's coming up. You can always then pick up your phone. We have a text concierge line for us as an example. Just text, say, I'm seeing this, I'm wondering about this, what about that? We can easily, knowing all the history, go yes, no, maybe. When you think about money, understand that if you take a procedure like Thermage or Ulthera, typically $3,000 to $4,000 or $5,000 just for a skin tightening procedure, CO2 laser, addressing skin, all great treatments. But you can get to $3,000 to $5,000 easy. A quick note before I go on home devices for RF and high frequency ultrasound like Ulthera. People ask me all the time, should I buy it? Does it work? You do not know the predictable energy output. Very key, because if you ever talks about melting fat, go to my Ulthera video and watch it. Everyone's like, hey, it melted my face, it ruined me for life. Out of thousands of people that saw the video, there's over, I don't know, 60,000, 70,000 views, and those people comment, there's always going to be a few. If you take one of those devices, I know with my devices over hundreds and thousands of patients what it's done, what the pitfalls, brown skin, light skin, dark skin, thick skin, thin skin, estrogen depleted. It takes a lot to know. You have to be doing a certain amount. If you get one of those devices, you have no idea what the energy output over time is, the stability of it, and easily on Instagram is where people message me who have all kinds of things they do at home, other physicians and providers. We're always talking. I don't mind it, but I see the disasters of what's happening. And so I just want to caution about a lot of at-home devices, and a lot of people also want to know, hey, I'm 40 years old, I have dark circles, what should I do? You know, there could be one of 40 treatments. You got to see the eye, the skin, the dark circles. Is it vessels? Is it brown spots? Is it sun exposure? Is there fat pad herniation? What does the top of the eye look like? What's it look like smiling and at rest? This is complex. I don't want to make it like it's more complex than it is, but a good provider that does this all the time, over time, as an art and has a passion for it, that's a typical treatment. That would be a typical price. And people, if you're doing things at home, don't treat other people, don't harm anybody else. But what people do in their own home, in their own time, people are going to McDonald's and eating burgers. They're not exercising, they're getting metabolic syndrome, they're harming themselves all the time. And certainly a lot of things can be done safely at home. And a lot of things are disaster. Be prepared for the disaster. Not to prepare is to prepare to fail. And in this case, when you fail, you lose something you only have one of, your face, body, life. So take care. Let me know your thoughts. Hopefully that helps. Hope you enjoyed it. Stay tuned here. Keep your skin and body beautiful, healthy, and vibrant.